COVID-19 outbreak is impacting vulnerable communities in all kinds of ways.
The U.S. Department of Veterans Affairs is seeing an increase in the use of mental health services by veterans. So we bring in mental health expert on the military and Syracuse University visiting professor Dr. Kenneth Marfilius live on Skype to talk about this. Dr. Marfilius, I must say, it is reassuring and good news to hear that veterans are taking advantage of those mental health resources, because for so long there's been a stigma around it.
Yes, indeed. COVID-19 has really accelerated the digital transformation across all sectors. We were really heading in that direction already, but the virus has forced us to think of ways to adapt and leverage technology in every facet of our lives. And so, the pandemic has exposed many of the social inequalities that we have known to exist and have now been brought to the forefront, has exacerbated pre-existing racial and health inequalities, really seen it disproportionately affecting communities of color and those with pre-existing conditions. Our veterans are part of the social fabric, and they have not been spared. Fortunately, to your point, the U.S. Department of Veterans Affairs was prepared, having utilized telehealth prior to the pandemic, and we now see how vital it is to the overall health of our nation's heroes.
Doctor, we talk about some of these inequities being applied to veterans here. What kind of problems is this pandemic bringing?
Yeah, so virtual mental health care and telehealth in general provides us with an opportunity to break down many of the barriers and bridge the gap. So again, as a result of the technology, veterans can now receive care in the comfort of their homes without having to worry. They may already have an anxiety condition that has now been exacerbated by the pandemic. So there's no need to worry about transportation. Those who live in rural areas sometimes have to travel hours to the closest VA facility, or indoor wait times, social stigma, and even caregiver or family obligations. So technology and telehealth have eased these burdens, and there are many, positive financial implications here also for both the veteran and the provider. They can receive on-demand services in times of crisis. There's no doubt that the pandemic situation is stressful. Experiencing increased anxiety about one's health and the health of one's loved ones is very real for all Americans.
Is there optimism on the sorts of treatment? Is the treatment that's happening remotely enough to kind of help our veterans kind of get through this stressful time?
Yeah, so the increase in mental health calls and utilization of VA Video Connect should not necessarily be viewed in a bad way. This tells us that the infrastructure, the system, is in fact working, and our nation's veterans are reaching out for help. I would continue to encourage our veterans to do just that. Our nation's veterans have given so much, and we must continue to be there to answer their call in times of need.
100%.
No one will be able to get through this alone. Social support is one of our greatest protective factors.
It's so true. Dr. Kenneth Marfilius, I hate to cut you off, but our time is up. But thank you so much for being with us and shedding some light on this issue.
Thank you.